Hi everyone, this is Miss Mekana. She's a 12-year-old Pyrenees mix. Pyrenees.
Yes.
Sorry, I had a brain fart there. Anyways, and we're gonna do some acupuncture and chiro today.
Yep, and a little bit of cold laser probably too. Mekana is the best ever. She is beautiful. She was adopted later in life, so I don't know. She couldn't be a sweeter gal. And she is a great example of what I was talking about in my latest Facebook Live, which was treating with a combination of both Western and Eastern medicines. She has some arthritis that we treat. She has some kind of little kinks in her back that throw her off chiropractically. She also has some struggles with her urinary health, and she's on medicines from both parts of the world to help with inflammation and discomfort with her arthritis, and also to help promote better bladder health and prevent urinary tract infections. So let's take a look at her today. And her dad and her auntie are dog hikers, so she has an excellent quality of life because she gets to go on so many hikes, right, Mekana? And that physical activity really keeps her strong. All right, so I'm going to look her over today. She also has a little bit of an eyelid lump that she's seen the ophthalmologist for, and they took a little bit off the last time they saw her, but she needs to have an additional procedure to get that back on track. And like many animals her age, she has a fair amount of dental disease. You can imagine if you didn't brush your teeth twice a day what your teeth would look like. And hers are pretty good, I would say, even for her age. She has a little bit of gingivitis and tartar. Just as an aside, Sam, it's great to get your puppies and kittens used to getting their teeth brushed.
Yes.
As youngsters, so that we can keep them healthy over time. And dental health affects so many things: liver, kidney, heart function. And we see it causing a fair amount of discomfort in our patients since we see a lot of older animals. And they're really good at hiding dental pain, dogs and cats, so you really have to look at it. So even though it's pretty offensive every time I look in my patient's mouth, I'm still pretty committed to it. Right, Mekana? So I'm just feeling her spine. When palpating for musculoskeletal misalignment, kind of has a nice feeling to it. So you can see she kind of feels good. Drooling a little bit. So it helps kind of swish around some of the fluid in the joints, which has some pain relieving qualities. It also stimulates the parasympathetic nervous system, so it can be relaxing as well. All right, young lady, we're going to feel her pulses for kind of evaluate her from an acupuncture standpoint. Mekana has a lot of problems that are inflammatory, so her tongue and her pulse and her symptoms and her body language lead me to go down a path of diagnosing her with something called spleen chi deficiency. So that results in a lot of dampness and a lot of heat. And in fact, her dad was just saying that she appreciates being iced her joints after activity, which is typical if you have a hot problem on your hands. All right. And she has kind of some, I would call those slippery pulses, indicating some dampness accumulation. So we'll work on her spleen meridian, which is in charge of processing fluids in the body. And in New England, we see a lot of dampness, especially this time of year, especially late summer and fall. A lot of damp heat conditions like skin allergies, ear infections.
She is posing so perfectly for the video.
She's gonna be a star, Sam. think last time Mekana's dad said that after she went home, she laid on each one of her beds. Took a nap on each one. I am not going to make her stand up for the next part. I feel like I know her pretty well and I'll examine her more on the way out, but she's nice and comfortable, so I'm not going to make her get up for that. No, just putting a little bit of different motion in her spine. So just one thing that we're noticing, a lot of dogs in particular, because they're mostly our outdoor pets. Actually, Sam, will you move back that way so she'll look
Yes.
that way so I can straighten out her neck a little bit. A lot of our more social creatures are having a hard time because a lot of people are staying at their distance and not being able to greet dogs in the same way that we would have before. So just keep that in mind when we're, ooh, that's a good spot. That's a good spot. So, I'm not sure that I have any great solutions other than as much play and as much company, much petting and touching as you can muster of people within your circles during this quarantine time, but it is so important to keep these guys enriched. Just like us, we're all missing the company of others.
Yes. And puzzle toys can also be a great solution for brain stimulation.
Absolutely. Some dogs appreciate, and cats appreciate music. Some appreciate video. Move those shoulders a little bit. There's some kind of cool chiropractic techniques that overlap with physical therapy. This is a technique called elbow traction, and all I'm doing is I'm sorry. Oh, there's more people outside. I'm flexing Mekana's elbow and putting my finger in between the area of flexion, and it can kind of help to nourish that area. I'm also going to move around the little bones in her wrist and get those joint fluid pockets swishing around and flowing too. I'm always happy for our pets that they're quadrupeds, so that when they do have struggles with one of their joints or one of their legs, that they have 3 spares to work with. But there's a lot of joints that get misinterpreted as feeling better than they are. Would you agree, Sam? Like, I think you and I both work a lot on things like the metacarpals, these long bones here.
Oh, yeah.
Loosen them up, the carpus or the wrist right here.
Even the toes.
Yeah. She's so good.
That is when they will let us work on the toes.
Yeah. But it's surprising when you say how many do. I don't usually attempt it in cats, but for most dogs, I feel like there's a different sensation that they feel if they're pretty well adjusted, in terms of like when we're going to stretch out their toes versus when we're going to trim their nails. I could hug Mekana forever. She's the best. We might like to trim that tooth a lot too after. Also, in our population of patients that tend to be older, another thing we think about a lot is their nail health. Because having longer nails as an older animal can, or more importantly, an animal with mobility issues, can really impact their ability to get around. And so we often do a lot of nail trims here. We also will do a fair share of trimming of fur between the toes. I'm not going to bother her now, but Mekana's a great example of having hair between her toes. Her dad trims them up really nicely, but that can be very slippery for dogs that have mobility issues. And we also use some different products that can be helpful for traction. Dogs, when, adjust right here, dogs, when they are younger, the way they're built, their nails are meant to go into the ground, and the pads of their feet will rest on top. When we ask them to be on laminate or hardwood floors that are so beautiful and so much easier to clean, it's really hard to balance, especially as they get older. So any form of traction can be really helpful, whether it's carpets or mats. Yoga mats work really well, indoor-outdoor carpet. We have these rubber floor tiles that we're using. In this room, we also use some different products, different kinds of boots that help with traction, and different kinds of things like these things called toe grips that can be really helpful. You have to apply them correctly. They definitely can help. She's a great camera gal.
I know.
Just feeling around her pelvis and her sacrum here.
Are you okay if I move now?
Yeah.
Just want to show everyone what you're doing.
Since not everyone is as still and as easy as this gal, we definitely use our fair share of treats in here in Sleepy Dog. One of our patients this morning was a big fan of banana chips, which was how we got our work done. Good job. Any questions coming up or anything, Sam, that you think I should go over for this gal? I'm gonna start putting some pins in.
No questions so far, but if anyone has any, feel free to write them and we're happy to answer them.
So speaking of traction, one of the things that has been really helpful in our building here, when I created the space, was to make sure that all the flooring had good traction for my patients. Most of the time we have this kind of indoor-outdoor carpet that has a rubber bottom and is easy to clean. But with COVID, we replaced it with a rubber floor in here, which has been really nice, and they can get a really good grip, but it seems to be a little bit cooler for them, which a lot of dogs do seek out the cool, especially big dogs or fuzzy dogs, and so that's really nice. But since we've been using the higher traction surfaces, I think you and I, Sam, have both noticed that a lot of dogs are a lot less worried
Yes.
coming in because they're not slipping on the floor. So that's kind of like a nice side effect, what we were aiming for.
I think it's also important to note that smaller dogs also have trouble, but they're much better at covering it up.
And cats.
Mm-hmm.
Lest we forget those kitties. Yeah, the smaller animals tend to be lighter, and so they can somehow hide those problems more.
Mekana just did a nice yawn, which is a really good sign that the points that Dr. Beth is putting in are working for her.
We've done some points that are good for arthritis so far and strengthening the immune system. I'm going to do some points that have to do with keeping the flow of chi and blood moving to help reduce pain and inflammation in the joints. Oh, that guy looked interesting. What was that? Huh? What do you think? Pyrenees are really good watchdogs, so I feel really safe here, huh? I know you can see your dad's car out there. We often, when we have our clinic running as it usually is, we often will strategically place our patients in this room with the big windows, or we also have some quiet rooms that don't have the distraction. Some dogs, like Mekana, like looking out the window, and it's a nice distraction and I can use it. Susie Q, who was here earlier, also, we often use the window. Oh, that's a tender spot. That's the gallbladder point. And that, the gallbladder meridian goes all the way from the face, all the way along the spine, down around the hips and the knees. So it would make sense that that was a little active, we would call it. It's doing a lot of work because she has some knee and hip and spine issues. Anyway, so we have some quiet rooms that we use, and sometimes we have to experiment a little bit because we have had lots of animals surprise us by preferring to be with a window, some of the cats, in fact, or animals that prefer to have the quiet and less interruptions. Hopefully soon we'll be getting back to that.
Yes.
But most of our clinic is built around trying to keep it calm. We try to have good footing, good music, enough space, and kind of low traffic when possible so that everybody can have their most calm state of mind, people and pets.
Yes.
And someday we'll have some outdoor space and we can have some senior play groups and maybe some calm grooming areas, bigger PT area.
Yes, we were just talking about how important senior grooming is, even with trimming the foot fur, seeing out of their eyes properly.
Right. And just feeling good. A lot of dogs and cats seem to feel better after they have a good grooming, but you have to be careful with it because it requires a lot of standing. And so if they do have any mobility issues, you have to take a lot of breaks.
Yes.
And there are a lot of mobile grooming places these days where they'll have a van or a mobile, I guess like almost like an RV, and that's nice because the animal's the only one there and you can really focus on them. So there's lots of good options there. Okay.
We'll show you a little bit of cold laser with Mekana.
I don't take it out. And Mekana is a pro at all of this. For most of our patients, we'll start with one kind of treatment modality and we'll add to it as they need it. So I think with Mekana, we started with chiropractic or acupuncture and then kind of layered things on. So I'm going to do my cold laser in an acupuncture point. It's a point that's associated with a meridian called the triple heater or the triple burner, which is a cool meridian. Not that one is cooler than the next one, but the triple heater is said to connect the three areas of the body or the three warmers of the body, and so it is like a very connective meridian. So one thing that we see that can be the case in older animals is that their triple heater meridian can be blocked, and so they get a lot of heat signs up top, so they might have panting, they might get really hot, they might be like a little bit having some doggy dementia, cat dementia up top, and then they get these cold symptoms below, so they'll have things like urinary incontinence or a lot of urination where they should have less than that. Another great thing about Sleepy Dog, Sam, is it keeps us flexible.
Yes.
We don't use tables. We're always on the floor, which I love, and helps the animals, I think, stay a little bit more comfortable.
I think so.
And so we have to make sure we do our yoga. I that's. I think the rest of what we're gonna do is just more of the same in terms of this.
All right.
I'll wrap it up. If anybody has any questions, let us know. Maybe the next Facebook Live, maybe we can get Chris to film. And
Oh.
we can do some physical rehabilitation or PT for animals.
Well, that'd be awesome.
Yeah. All right.
All right.
Thanks, guys.
Bye,
Have a good day.
guys.
Enjoy the sunshine.